Hello, my name's Erica. I'm going to be your provider for today. Can I get your name?
Christian.
Christian. Very nice to meet you. How old are you?
I'm 20.
Okay. And what brings you in today?
Well, I wanted to come for a checkup, and for the past month, I've had a pretty bad cough that I haven't really been able to get rid
Okay. So this cough, let's get a little bit more about it. When did you notice it start? You said a month ago.
of.
Was there
Yes.
something specific you were doing or?
No, I know I was outdoors, and at the time it was a little bit colder, and I wasn't too bundled up, so I kind of was under the assumption that's where it originated.
Okay. Where would you say the cough is? Is it something that's heavy in your chest? Do you feel it kind of?
Definitely. Yeah,
Okay.
definitely very heavy in my chest.
How would you describe the cough?
I would say well, it's kind of gotten worse throughout this last month, but it's very harsh. And you could hear it in my breath when I take deep breaths. You can just sounds a little wheezy.
A little wheezy.
Mhm.
Okay. Any shortness of breath? Any pressure on the chest?
No, not really.
Okay. Have you had any problems, doing your normal activities? Any problems with exercising or anything like that?
No.
Okay. Typically, when do you notice that this cough gets worse? Is it constantly throughout the day, or is there certain times of the day where you notice it's a little bit worse than others?
I would say it's pretty constant throughout the day. It usually only gets worse if I drink cold liquids.
Okay, so the cold liquids tend to help make it a little bit worse.
Yes.
Anything that makes it better? Have you been on any medications, any antibiotics for this?
Not yet.
Okay. Um, Is there any other symptoms that you're feeling? Do you have any congestion or sneezing?
Yeah, sneezing, no, but I would definitely say my nose has been really stuffy and it's runny kind of a lot. And then aside from that, that would be it.
Okay. Any pressure in the face or anything like that, or any problems
Mm,
with your ears or your eyes?
Pressure, no. I know I do commute up and down the hill, so my ears always have a problem with elevation. So
Adjusting.
so they've been getting plugged, and then they'll kind of stay plugged throughout the day
Okay.
until I drive back up the hill, or they kind of just goes away on its own.
Okay. How about any fatigue? Have you been more tired than usual, or do you have trouble sleeping? Does the cough wake you up in the middle of the night by any chance?
Um, no, not really, and I haven't really had too many problems sleeping.
Okay. So you're saying it's kind of like a wheezing cough that you notice is really heavy and it's just really harsh. It's kind of gotten worse. Do you cough anything up at all? Anything, any kind of discharge or like a phlegm or sputum?
Yeah, there's definitely phlegm. Towards the beginning of the month, it was a little bit more of a brown color. Then it kind of transitioned into more of a yellowish color. Um, but yeah, just the phlegm.
Have you noticed any fever or anything like that?
No.
Any body aches?
No.
Okay. All right. So aside from this cough, how would you say your general overall health is? Would you say you're healthy, or is there anything else you've been diagnosed with before?
No, I would say I'm fairly healthy. I know, maybe sometime last year I was at the doctor's for the same reason, which was the
Okay.
bad cough. And it was a mild form of bronchitis.
Okay. Did you have any chest X-ray done by any chance or anything?
I did not.
Okay. Have you ever had any chest X-rays done or any other problems like
Mm,
pneumonia?
no, nothing.
Okay. Do you have any allergies to any medications?
I did not.
Okay. How about anything to any food? Peanuts, nuts, anything like that?
No.
Okay. Any seasonal allergies?
To my knowledge, no.
Okay, and you're not allergic to any cats or dogs, latex, nothing like
Mm-mm.
that. Okay, and what do you do for work?
I'm a manager for Michael Kors.
Okay, so you work full time, correct? And you
Correct.
said you do commute.
Hmm.
Okay. As far as the cough, do you smoke by any chance?
I did not.
Okay, and how about any drugs? Okay, do you drink alcohol by any chance?
I do.
Okay, how often would you say you drink?
I would say once every week, maybe once every other week.
Okay,
Kind
just
of
kind
more
of a social.
social, yeah.
Okay, how many drinks would you say you drink per event?
Um, I would say maybe 3 to 4 drinks
Okay,
every
three to
time
four
I go
drinks.
out. Yeah.
And what are we talking like beer, wine, hard
Mainly
alcohol?
beer. Yeah.
Okay. All right. Um, as far as your family goes, is everyone pretty healthy? What would
Yeah.
you say? Any
Yeah, I would say
siblings?
yes. I have one sister.
Okay, and how is she? She's
Yeah, she's healthy as well.
okay, and how about the parents? Are your parents both alive still?
Yeah, my parents are both pretty healthy. Um, no medical problems that I know
Okay, how about the grandparents on your mother's side?
of. The grandparents on my mother's side, I know my grandfather's pretty healthy. Same as my grandmother. I know she does have high blood pressure, but no other existing, issues that I'm aware of.
Okay, and how about your father's side or both your grandparents?
On my father's side, my grandmother's fairly healthy, and then my grandfather passed away a couple years ago due to liver problems. I'm not really too sure.
Okay, so some kind of a liver history there.
Mm-hmm.
Okay. Um, so you said generally you're pretty healthy for the most part. You've never been diagnosed with anything else, correct?
Mm-mm.
Okay. Are you currently on any medications?
No, no.
Okay. Do you take anything over the counter?
Mm-mm.
Okay.
No.
Any vitamins or supplements or anything like that?
I did get it was like a positive mood supplement. It's called 5-HTP.
Okay.
That's the only thing that I'm currently taking now.
Okay. Any side effects or anything like that?
No.
Okay. All right. How about just kind of getting a little bit more into your physical well-being? How about the skin? Everything okay with your skin? Any dryness, itching, anything different?
Mm-mm.
Okay. How about head? I know you said the cough, but you didn't really say you don't have any problems with headaches, any lightheadedness, dizziness.
Mm-mm.
Okay. And everything okay with the eyes? No blurred vision, any contact lenses or glasses?
Mm-mm. No.
Okay. Have you ever had trouble with your vision?
A little bit when I was younger. I went to an optometrist about 2-3 years ago,
Mm-hmm.
and I was prescribed night driving glasses,
Okay.
but I kind of got to a point where I didn't feel like I needed them, so
Okay.
I stopped
Was
using
it so
them.
much like the visual aspect, or is it more of just like the bright lights that you need the glasses for?
It was more for bright lights, I would say. I
Okay,
don't
so
really
just
have
kind of the glare that bothers you.
Yeah, I don't really have too much of a problem with the actual vision.
Okay, so you're just not really using those if you need them.
Correct.
Okay, any problems with dry eyes, redness, anything like that? Okay. How about the ears? I know you mentioned that pressure with elevation changes. Anything other than any difficulty hearing or any ringing in the ears?
Ringing of the ears, sometimes I've noticed that it's usually when I get home from commuting. If my ears haven't unplugged, then I have like a slight ringing in them.
Okay.
But that's the only.
And do you have to do anything for it, or does it just kind of go away on its own?
Sometimes it goes away on its own. Sometimes if I plug my nose and I blow out, like I can.
To release the pressure.
Yeah, I can release the pressure, but it's one of the two. It kind of just depends.
Okay. Is there any other times where you have problems with the pressure, or is it just simply the driving and the commuting?
It's been mainly just the driving and the commuting, but I never had this problem with my ears up until when I started getting sick this last month.
Okay. Any problems with, you said no problems with your sinuses, there's no pain here above the eyebrows or here in the cheeks?
Mm-mm.
Okay, if you were to press on it, you don't ever feel like you have pressure, no
No.
kind of headaches?
No
How about
pain.
the neck? Any stiffness, any problems moving?
No.
Okay, and the throat, do you have any problems with your throat? Any soreness, dryness? Is it hoarse at all?
Sometimes within this last month, mainly, it is a little bit sore, mainly in the mornings.
Okay.
But it kind of goes away within like a couple hours of me being awake.
Okay, so everything's kind of associated with the cough. Do you
Yeah.
snore at all by any chance, or sleep with your mouth open? Do you know?
Oof, that I don't know.
Okay. All right. How about your any problems with the breathing? I know the cough. You said you have a little bit of a wheeze, but do you have any problems? Are you still able to exercise? Okay.
Yes, I am.
Okay. Have you ever had you've never had any chest X-rays or anything like that? So nothing abnormal that you're aware of. Any asthma, bronchitis? I know you said they had that one episode last year.
Mm-hmm. Okay. Aside from that, no.
Have you ever had pneumonia before?
Not that I know of.
Okay. And do you use an inhaler by any chance? Have you ever been prescribed that?
I do not.
Okay. And you said no medications for this cough at all. So,
correct.
Okay. How about your heart? How would you say any problems with your heart? Is it over healthy?
I would say no problems.
Okay. Any murmurs or anything like that?
To my knowledge. No.
Have you ever had any chest pain associated that you would feel like was a heart issue?
No.
Okay. How about your stomach? Everything okay with your stomach?
Mm-hmm.
Any recent changes in weight loss or weight gain?
I've had slight weight gain.
Okay.
But I've been going to the gym a little bit more consistently, so.
Okay. So nothing that's been abnormal that you can't explain.
Yeah. Nothing
Okay.
abnormal.
Any issues with, like constipation, diarrhea, anything like that?
No.
Okay. How about the urinary tract? Any difficulty urinating? Do you feel like you have to go frequent, or you have the urgency to go very often?
No.
Okay. And then as far as that goes, any problems with the genital, any, discharge?
No.
Okay. Are you sexually active by any chance?
I am.
Okay. And you use condoms, protection, anything like that?
Yes.
Okay. Have you ever been checked for STDs?
No.
Okay. How about the HPV vaccine? Have you ever had that by any chance?
Mm.
Okay. If that's something you're
I don't even know
interested,
what that is.
we can talk about. HPV is a common STD that many people get, and it's not really known how it's transmitted, but typically people in your age range, it is recommended that you get vaccinated for it, and it doesn't hurt. It's something that we can talk about it later on if you're more interested in that.
Totally.
How about the bones, joints? Everything okay with that?
Yeah, nothing abnormal.
Okay.
Sometimes I get pains in some of my, I would say, bones, but that's usually only when I'm on lack of sleep.
Lack of
But
sleep.
nothing abnormal.
Okay, where would you describe this pain? Is it
It's typically like on my forearms or on my shins.
Okay, how would you describe it? Is it a sharp pain or like a numbness or a tingling or aching?
It's an ache for sure.
Okay. And you said it's just typically lack of sleep. So
Yeah.
if you were to get rest, is that something that resolves with the rest?
Oh yes.
Okay. But nothing you have to take any medication for or anything?
No.
Okay. Sounds good. Have you ever broken any bones or anything like that?
Yes, a couple. I've broken my collarbone and I've broken my arm.
Okay. Any problems with that since or any surgeries?
No. I know in the wintertime sometimes my collarbone it has like a slight achiness when it's really cold.
Mm-hmm.
But aside from that, that's the only.
Okay, and are you still able to move everything okay? No problems with your range of motion at all?
No problem with range of motion at all.
Okay, and you don't have to take, it's not something that's severe enough to where you have to take medication for?
Correct.
Okay. How about neurologic wise? Have you ever had any problems with your memory or, any slurred speech?
No.
Okay. How about any lightheaded or dizziness?
Mm-mm.
Okay, any generalized weakness? Have you ever had something on one side where you feel kind of weak?
No.
Okay. How about your have you ever had any problems with bleeding? Do you bruise easily, or have you ever had any blood clots or anything like that? Nothing that you're aware of.
Nothing I'm aware of.
Okay. And how about temperature wise? Do you find yourself being like sensitive to temperature changes, whether it's hot or cold?
No, I would say I'm fairly normal.
Okay, and everything okay with your lymph nodes? Has anyone ever told you have enlarged lymph nodes or anything like that?
No.
Okay. And how about any problems with depression, anxiety? Any ever had any suicidal like ideations or anything like that?
No.
No? Okay. So pretty much it's just the cough then, right?
Yes.
Everything's kind of associated. You mentioned that pressure with the ears.
Mm-hmm.
You mentioned kind of that wheezy feeling, but nothing that you've ever been on medications for.
Correct.
Is there anything else I missed, or is there anything else you would like to tell me about today or discuss?
Mm-mm.
No? Okay, sounds good. Well, we'll go ahead and follow up. We're going to talk about a little more about that cough and probably try and see if we can get you started on an antibiotic.
Okay.
And then we will kind of go from there.
Cool.
All right, it was very nice meeting you.
Nice meeting you too. Thank you.